Hello, my name is Sarah and I'm the president and founder of Operation Truth Vaccination Exposure Research. At the beginning of the week, I shared a couple videos of how Raynaud's phenomenon presented throughout my body and how I was able to connect my Raynaud's phenomenon to the anthrax side effects. Today I'm going to discuss what Raynaud's phenomenon is and how I effectively treat my Raynaud's phenomenon. According to John Hopkins Medicine, Raynaud's phenomenon is a problem that causes decreased blood flow to the fingers. In some cases, it also causes less blood flow to the ears, toes, nipples, knees, or nose. This happens due to spasms of blood vessels in those areas. The spasms happen in response to cold, stress, or emotional upset. Raynaud's can occur on its own, known as primary form, or it may happen along with other diseases, known as secondary form. The diseases most often linked with Raynaud's are autoimmune or connective tissue diseases such as lupus, scleroderma, Crest syndrome, which is a form of scleroderma, rheumatoid arthritis, thyroid disorders, pulmonary hypertension, and many others. The exact cause of Raynaud's is unknown. It is possible that some blood disorders may cause Raynaud's by increasing the blood thickness. This may happen due to excess platelets or red blood cells, or special receptors in the blood that control the narrowing of the blood vessels may be more sensitive. Certain factors can increase your risk of developing the condition, such as a connective tissue or autoimmune disease, chemical exposure, cigarette smoking, injury or trauma, repetitive actions such as typing or use of tools that vibrate like a jackhammer, as well as side effects from certain medicines or, in my case, certain vaccines. Symptoms can occur a bit differently in each person. Common symptoms include fingers that turn pale or white, then blue when exposed to cold or during stress or emotional upset, then red when the hands are warmed. Hands that may become swollen and painful when warmed. Sores on the finger pads develop in severe cases, and gangrene in the fingers that causes infection or needs amputation, which is rare. According to the National Institute of Arthritis, Musculoskeletal, and Skin Diseases, when a person is exposed to cold, the body tries to slow the loss of heat and maintain its temperature. To do so, blood vessels in the surface layer of the skin constrict or narrow, moving blood from vessels near the surface to those deeper in the body. In people with Raynaud's phenomenon, blood vessels in the hands and feet react to cold or stress, narrowing quickly and staying constricted for a long period. This causes the skin to turn pale or white, then bluish as the blood left in the vessels becomes depleted of oxygen. Eventually, when you warm up and the vessels expand again, the skin flushes and may tingle or burn. John Hopkins states that treatment will depend on your symptoms, your age, and your general health. It would also depend on how severe the condition is. There is no cure for Raynaud's phenomenon, but it can be managed with proper treatment. Treatment may include avoiding exposure to cold, keeping warm with gloves, scarves, socks, and a hat, stop smoking, wearing finger guards or over fingers with sores, avoiding trauma or vibrations to the hand, such as with vibrating tools, taking blood pressure medicines during the winter months to help reduce constriction of the blood vessels. Of course, talk to your doctor about your own health journey before starting any treatments. The treatments that I find are the most helpful are, of course, avoiding your triggers once you identify them, dress in layers and prepare for all climate change possibilities depending on what, when, and where you'll be located. As a result of being a chronic multi-symptom illness patient, I am unable to take blood pressure medications that would help reduce constriction of the blood vessels during the winter months. However, I've chosen to live in Michigan, so I do my best to avoid exposure and protect my body when I do choose to go outside. The root cause of my secondary Raynaud's phenomenon is still undetermined at this time. The symptom of flushing was determined to be caused by the anthrax vaccine and was listed on the package insert. Without further research and diagnostic testing, we may never know just how damaging adjuvant vaccines like the anthrax vaccine protocols truly are. It is so important to determine the root cause of your disease in order to properly treat the root of the problem. Otherwise, you are just treating the symptoms and you'll never properly heal. Last week was the beginning of a series Operation Truth is conducting to show our fellow chronic multi-symptom illness patients how to conduct your own root cause analysis. If you're interested in learning more about your own health journey, then send an email to the contact listed on your screen. Our next video in this series will cover how autonomic neuropathy presents in the body and how I was able to connect the nerve damage disease to the anthrax vaccine. Thank you for your support. Don't forget to subscribe and have a great weekend.